Hey everyone! Today, we're diving into a topic you've probably seen thrown around online, but it's one that almost never gets a clear explanation. We're going to look at the actual science of sensation to understand something people call the death grip, and, more importantly, what you can actually do about it. So, have you come across this term? It's definitely slang, and it sounds kind of intense, right? But it points to a very real experience that a lot of people have questions about. So, let's get some clear answers. Here's what we're going to cover. First, we'll define what people actually mean by death grip. Then we'll get into the science of what's happening in your body. From there, we'll look at the real-world impact. Then I'll walk you through a practical guide to reset things. And finally, we'll zoom out to see the big picture. All right, section 1. So what is the death grip? First things first, and this is really important, this is a slang term. You're not going to find it in any medical textbooks. It is not a formal diagnosis. It really just describes a style of masturbation that tends to involve 3 key things: really strong pressure, a very repetitive technique that doesn't change much, and just an overall high level of intensity. The concern people have is that this very specific, very intense habit might change how they experience sensation in other situations. So how does that even work? That brings us to the science of sensation. And here's the absolute key takeaway for this section. We are talking about conditioning, not permanent damage. And that distinction, it changes everything. The scientific idea that explains this is called habituation. And look, in simple terms, your nervous system is incredibly smart and efficient. If you give it the same, very intense signal over and over and over again, it just gets used to it. It adapts and starts to expect that level of intensity. And as a result, other stimuli that are, less intense might not feel as powerful. And this is where the difference really becomes obvious. When you think about it, during solo masturbation, especially with a tight grip, it's possible to create way more pressure and friction than what usually happens with a partner. Plus, you have total control over every little movement. Partnered sex, on the other hand, is just naturally more varied. It's less predictable. It's a shared experience. And it's that contrast that can lead the nervous system to get conditioned to that one specific, intense thing. Okay, so what is the actual real-world impacts of all this? Let's take a look at how it can affect you and your relationships based on the research we've got so far. Now, I have to be upfront. There isn't a mountain of research on death grip specifically, but one small study did find some pretty interesting connections. It noticed that men who had concerns about their erections were more likely to say they used these really intense masturbation styles. It also noted that guys without those concerns were more likely to use lubricant. But, and this is a huge but, we have to be super clear here. The researchers themselves say this study does not prove that one thing causes the other. It only shows an association. You know the classic saying, correlation doesn't equal causation? That is exactly what's happening here. Now, when this kind of conditioning does create a noticeable gap between solo and partnered experiences, it can lead to some really tough challenges. Things like having a hard time climaxing with a partner, which can lead to frustration or embarrassment. And that can spiral into communication breaking down or even avoiding intimacy altogether. Okay, so let's get to the good part, the solutions. This whole section is about taking action. If any of this is sounding familiar, here's a practical 4-step guide to help your body recalibrate and, rediscover a wider range of sensations. But hold on. Before you start anything, this first step is absolutely non-negotiable. It is so important to talk to a doctor and rule out any other underlying medical causes. Things like stress, hormones, even your cardiovascular health can play a huge role in all this, so getting a professional opinion is always the right first move. So, once you've gotten that all clear, the plan itself is pretty straightforward. It's got 4 stages. First, you just reflect on your current habits. Then, you might consider a short reset period. After that, you slowly reintroduce new and more varied types of sensation. And the final piece of the puzzle is to practice mindfulness through the whole process. So let's zoom in on step 3, because this is where the action is. The name of the game here is variety. Try using lubricant. It can totally change this sensation and reduces the need for so much friction. Consciously use a lighter touch. Mix up your speed and your technique. You could even try something like using your non-dominant hand. It feels totally different and breaks that muscle memory. Or just focus on exploring different areas. Okay, let's pull back for a second and look at the big picture. It's really time we reframe this entire conversation and put it all in a much healthier perspective. And that brings us to what might be the single most important takeaway. The issue here isn't masturbation. Masturbation is a normal, healthy part of human sexuality. The potential problem is rigidity. It's getting stuck doing the exact same thing at that same super high intensity every single time. And here's the best news of all. The thing I really want you to remember is this: your body is amazing. Your nervous system is incredibly adaptable. It learned one way, and it can absolutely learn another. With just a few small intentional changes, it can often recalibrate really successfully. So I'm going to leave you with this final thought. What if we've been looking at this from the wrong angle? What if we shift our focus away from thinking about what we need to restrict or stop doing, and instead focus on what we can add? What if the real key to a better, more fulfilling sex life isn't about limitation, but about embracing and exploring variety?